everyone. Good morning. Thanks so much for joining us. Welcome to the second episode of the Uprooting the Structural Drivers of Health Inequity series. My name is Hazarika Watts. I'm a senior attorney at ChangeLab Solutions, and I'll be facilitating today's discussion. I invite you all to introduce yourselves in the chat as we get settled. Please go ahead, share your name, organization, and where you're joining us from. Our next slide is just going to review a few quick notes. First, this event is being recorded. It will be posted on the ChangeLab Solutions website within the next week, along with the slide deck. You'll also receive a follow-up email with a link to the recording once it's ready. The chat function is open. We encourage you to share any reactions, share resources, engage with each other. If you have questions that you specifically want to submit to the speakers, please use the Q&A function. We've already received several questions through the registration forms, and our panelists will be touching on some of those in our discussion today. If you'd like to join us in live tweeting during this event, we invite you to use the hashtag Uprooting Inequity. Our next slide has some details here about live transcription. It's going to be available for the session. In your Zoom window, you should see a button that says Live Transcript. It's pictured here on the slide. If you click on that, you'll have the option to either show or hide subtitles. You can also adjust the font size to fit your preferences under subtitle settings. Our colleague, Bernard Lim, is helping us ensure all of the tech runs smoothly today. If you run into any technical issues, you can send him a direct message via Zoom. ChangeLab Solutions works across the nation to advance equitable laws and policies that ensure healthy lives for all. We are an interdisciplinary team of lawyers, planners, policy analysts, public health practitioners, and other professionals who collaborate with community-based organizations, local and state governments, and anchor institutions such as hospitals and universities to create thriving, just communities. Our priority is assisting communities whose residents are at the highest risk for poor health. ChangeLab Solutions' strength lies in using the tools of law and policy in a collaborative, multifaceted, and cross-sectoral way to ensure policy solutions that are both practical for government systems and institutions and meaningful for the people they are meant to help. ChangeLab also works with change makers to improve their knowledge and capacity to use law and policy to change systems, policies, and practices to advance health equity. Today's webinar is the second installment in our six-part series, Uprooting the Structural Drivers of Health Inequity. We kicked off this series earlier this month with an overview of the structural drivers of inequity and a discussion of how government, community organizations, and philanthropy are reimagining their approaches in the context of the pandemic, economic crisis, and a growing movement for racial justice. Today, we'll be building on that foundation to talk specifically about the equitable enforcement of employment laws. We'll be talking about laws and policies that affect workers with low income and how inequitable enforcement of laws intended to protect these workers exacerbate health-related inequities. I'm thrilled to introduce the panelist speakers who will be engaging in this conversation today. We have Ruqaiijah Yearby, JD MPH. She's a full professor and member of the Center for Health Law Studies at St. Louis University School of Law. She's also co-founder and executive director of St. Louis University's Institute for Healing Justice and Equity. She recently authored a report entitled Protecting Workers That Provide Essential Services. You can find that in the COVID-19 Policy Playbook. She's also co-authored Racism as a Public Health Crisis, Here's How to Respond. Using empirical data, her research explores the ways in which discrimination prevents vulnerable communities from attaining equal access to quality healthcare, resulting in health inequities. Next, we have LiJia Gong. She serves as counsel at Public Rights Project, an organization that supports and empowers local and state governments to protect workers, consumers, and the environment. She represents cities in litigation and provides policy advice and technical assistance to advocates and local governments. LiJia has represented clients in nearly all phases of litigation in cases before state and federal courts in private practice, and served as a law clerk to Judge Kiyo Matsumoto of the U.S. District Court for the Eastern District of New York. And finally, we have Jared Make. Jared serves as vice president at A Better Balance. He's worked with advocates and coalitions to draft and pass dozens of state and local laws that guarantee paid sick time, paid family and medical leave, and emergency leave for COVID-19 and other public health emergencies. Jared co-founded a Better Balances LGBTQ rights and family recognition project to advocate for the rights of LGBTQ workers. He also launched the Defending Local Democracy Project, a nationwide effort to strengthen, protect, and defend progressive local laws. Next, I just have a few slides I'll run through to set the context for our discussion today. Shrinking the gaps in health outcomes differs from trying to improve public health overall. It's a complex objective that requires new thinking and new strategies for action. So rather than focusing on reducing the prevalence of any single disease, the challenge is finding ways to change the distribution of healthy environments, economic resources, and opportunities. Finding those solutions requires a fundamental shift in how policy is used to promote health. So these 5 fundamental drivers are forces that create health disparities. For decades, public health approach to improving health has been to move upstream, that is, to address the root causes of health problems. For example, public health efforts have focused on preventing obesity and heart disease by creating environments that support physical activity and provide access to healthy food. But despite many successes, health outcomes for some populations still have not improved enough. And in some cases, health disparities have increased at alarming rates. Policies and practices at every level have created these barriers to good health. We need to work together to alter the systems that keep these inequities in place. Enforcement is a critical piece of the puzzle that cuts across all 5 drivers. Laws and policies that seek to address each of these drivers need to be equitably enforced in order to achieve their intended goals. So what is equitable enforcement? I want to back up a minute and recognize that there's a significant gap between the promise of our laws and people's lived experiences today. This gap exists in part because laws and policies designed to keep people safe and healthy are often not enforced, or when they are not enforced equitably in a way that promotes health and well-being for the most marginalized, often creating, maintaining, or exacerbating existing health inequities. Equitable enforcement, on the other hand, can hold wrongdoers accountable while simultaneously protecting the health and well-being of individuals and the community. Equitable enforcement is the process of ensuring compliance with law and policy that considers and minimizes harms to underserved communities. The COVID-19 pandemic has really highlighted the importance of equitable enforcement as a cornerstone of governmental rapid response. Cities, counties, and states are actively working to slow the spread through a number of different policy interventions. But it's really important that jurisdictions think carefully about who is tasked with enforcement and how those orders are being enforced to avoid potential inequitable impacts. We know that consequences like criminal and civil fines and jail time can themselves inequitably impact poor people and people of color. We know that they can exacerbate health inequities that result largely from centuries of racism and structural discrimination. Last summer, we published a guide on equitable enforcement for policymakers. It explores some best practices in design and development of enforcement provisions to avoid inequitable impacts and promote community health. We hope this guide can support communities in advancing health equity across the country. We believe that equitable enforcement is fundamental to creating, implementing, and enforcing laws and policies that support people's ability to thrive. At ChangeLab, we also understand that inequitable enforcement, economic inequality, and poor health outcomes are inextricably linked, connecting back to the drivers of income inequality and poverty and structural discrimination. While laws exist to protect workers, enforcement is spotty and it's often difficult to navigate. We believe that enforcement can be more effective and more equitable when it addresses root cause, targets those with the power to make systemic change, and reduces or eliminates barriers for those with less power. For example, enforcement of labor violations is generally complaint-based. These systems require workers to report abuses and place them at risk for retaliation. While policies may exist to protect workers against that retaliation, those often go under-enforced as well, given the immense power and resource differentials between employers and employees. We believe that making workplaces safer and more equitable for workers would help stabilize employment and improve long-term outcomes for families at the margins. I'm going to turn to our panelists now, invite them to share a bit about their experience working to address inequities in the employment context through law, policy, or other systems. Ruqaiijah, can you kick us off?
Yes, thank you. So I'm going to talk a little bit about the work that I am doing at the Institute for Healing Justice. So we were founded in 2018, and I have primarily looked at healthcare and how it is connected to employment. And so, as we think about this institute, it is a multidisciplinary group of faculty. We are working to eliminate disparities. Some key points that we are community led, informed, and driven. Our work is about partnering with community. And as you mentioned, a lot of these issues go to the harm. We want to dismantle the systems in equitable enforcement, but also ensure that we provide healing, that our work that we do is about transforming the systems in our communities and really about community capacity building. And a lot of the work that I have been doing during the pandemic has really focused on home health care workers, direct care workers, meat and poultry processing workers, farm workers, and looking at those who work in hospitals, cleaners, just to identify the gaps and the structural barriers to keeping them safe. So with that, I'll stop.
Thank you. Next, we'll hear from LiJia. If you could just give us a quick overview.
Hi, everybody. Thanks so much for being here. I am, as counsel at Public Rights Project, we've done a lot of work on equitable enforcement, which I think Maya has just done a great job of explaining. In particular, we, focus and work with city and state governments. So that is city attorneys and also attorneys general, as well as kind of Department of Labor type agencies. And we've really been focused on issues like wage theft, and that is kind of it's a term that's used to describe enforcement of or lack of enforcement, or when there are violations of wage and hour laws. So that's kind of minimum wage and overtime laws. We've also done a lot of work around the enforcement of classification of workers, and that's a legal term, but it's really about whether workers are properly classified as independent contractors or employees, and that's a common problem in the gig economy. And we've also been really focused on, recently with the pandemic, worker safety issues. And I know Ruqaiijah spoke a little bit about what's happening in kind of the various food production facilities, which I think there have been a lot of worker safety issues. And kind of how we do that is both by, I think, talking directly with workers, developing legal theories and about violations, and then ultimately kind of sharing and pitching some of those matters to state and local enforcers. We also kind of train and provide technical assistance to these state and local governments on their authority, how to equitably enforce, and we'll talk a little bit more about that. And ultimately, kind of seek meaningful remedies for harmed workers.
Thank you so much. Love to hear the way that your areas of work overlap in such a nice way. And finally, we'll hear from Jared.
Yeah, hi everybody. Jared Make, Vice President of A Better Balance. Thanks, Maya, and your colleagues at ChangeLab as well for your work on putting this together. So I've been working on workplace justice issues at A Better Balance for more than 10 years now. And A Better Balance is a national legal advocacy nonprofit with offices in New York City, Tennessee, Washington, D.C., and Denver, Colorado, which is where I'm based. And our mission, as you'll see here, is to leverage the power of the law to ensure that workers can care for themselves and their loved ones without risking their economic security. So some of the issues you can see here that we focus on around the country, but also on the ground where our offices are based in those regions, include paid sick time and paid family and medical leave, two areas where I've been particularly focused, as well as emergency leave in the past year relating to COVID-19 or future public health emergencies. And then you can see we work on pregnancy, lactation, and caregiver discrimination issues and accommodations, LGBTQ rights, and recognizing family diversity in the law. Preemption issues, which I work on pretty closely with LiJia, around state interference with the ability of localities to pass protections on these issues and many others, fair scheduling and equal pay. And just very briefly, a little bit on our model at A Better Balance. We have 4 integrated strategies that we use. The first, which is direct legal services. We have a free national legal hotline. Those issues I just discussed that you saw on the last slide are issues that we hear from workers every day around the country. And then we provide legal advice, representation, engage in impact litigation as a second strategy. And all of that work on the ground and what we hear from working individuals every day then impacts the policy and legislative work that we do as well, an area that I focus. And that's everything from bill drafting and legal research to testimony, helping advocates negotiate bills, and then once something passes, implementation. And then the final piece of our strategy involves education, empowerment, and enforcement. So we are very involved in trainings and public education of workers around the country on the ground where our offices are, working with legislators and the public. And, very important to us, worker empowerment. So a lot of our hotline callers, particularly where there wasn't a protection to address their situation, have become community ambassadors through a program that we continue to build and develop to get very involved in creating policy change. And then we also help to enforce and defend the laws that we are involved in passing. But all of that is just to say we have quite a feedback loop that continues where our policy and our legislative work is directly informed and refined based on the lived experience on the ground and what we're hearing on these issues from workers every day.
Thanks, Jared. That dovetails so nicely with some of the strategies that we have in our Equitable Enforcement Guide, which I encourage everyone to check out as well. I'd now like to pose a question to each panelist before we open up to the group discussion. So Ruqaiijah, I'd like to start with you and some of the big picture issues here. How does structural racism show up in employment law and enforcement? And what are some beginning steps that we might see to move forward under a new federal administration?
Great, thank you. So I just want to highlight that for me, structural discrimination, definitely including racism, but also sexism, classism, ableism, really is about how we use laws to structure systems, particularly the employment system, in a way that benefits the dominant group and disadvantages minorities. And it's all about power. It does not necessarily require bad intent. Next slide. And I'm going to focus on particular things, especially women of color. There are always discussions about education, how it will equalize it, or working more hours will equalize it. But we see that pay inequities persist, particularly between women of color. And in fact, oftentimes as they increase their education, the gap gets bigger. Next slide. We also see these problems, as was mentioned during COVID-19, right, that workers are being left out of economic relief bills, whether that's home healthcare workers because their industry lobbied to keep them out, or whether that's because they're undocumented immigrants, which a lot of the food and agricultural workers are, or because we have limited the paid sick leave and other protections to smaller employers. And so meat and poultry processing companies that are really big don't have to provide these benefits. And so their workers are left without paid sick leave. Furthermore, they have a punitive attendance policy. So even if they have paid sick leave, many of the workers would not take it because they're penalized for taking off time, even if they are sick. Next slide. Sorry. And so how does this lead to health inequities? We see that it increases rates of stress, income inequities. We see that it has been associated with very low birth weight infants, which is one of the ways that people have talked about Black women have increased rates of infant mortality. Next slide. And it has led to health disparities in the spread of COVID-19, particularly among meat and poultry processing workers who are predominantly people of color, but not just them, it is also tied to their communities, right? So increased rates of COVID-19 cases because they don't have paid sick leave. Next slide. And so one of the ways that we can begin to address this is by adopting the health justice framework, particularly as we think about policy making. And it has three principles. And this is really based on my work with Professor Emily Benfer at Wake Forest, Professor Seema Mohapatra at St. John's University, and Lindsay Wiley at American University. The first prong is to address structural discrimination, right? And so that if we're thinking about passing paid sick leave, as we did under COVID-19 economic relief bills, that we can't just leave gaps. We have to cover essential workers, right? So we can't exert out home healthcare workers, undocumented immigrants, or those who are essential workers. If we want people to stay at home and also to redress prior harms, we have to provide financial supports and accommodations. And you see lots of places, including California, many places in California, passing hazard pay laws. And as was mentioned by Jared, empower and engage community, empower and engage these workers because they know what will address some of these gaps. I just want to highlight two more things. Next slide. So when we think about achieving equity, equal pay for equal work, and more pay for more work for those who are actually doing more, that being paid less, a living wage and paid sick leave, as I mentioned, hazard pay, and guaranteed basic income. Oakland, California has adopted this, and other places have actually used their COVID economic relief funds to begin to try to give some residents guaranteed basic income. But at the end, workers should be involved in reforming the policies. Next slide. Here are my co-founders at the Institute who are addressing some of these issues as well. And then next slide, it has our program director and our contact information if you have additional questions. So with that, I'll stop. Thank you.
Thanks, Ruqaiijah. That's a really great overview. Now, LiJia, I'd like to turn to you next to dive into some of the specifics in the employment context. So what does the workers' rights enforcement landscape look like, and what is the role of federal, state, and local governments here?
Yeah, I think I feel like Ruqaiijah did such a great job of setting, I think, really the scope of the issues that we have to contend with. And I am gonna, I think, narrow in a little bit on enforcement. And, I think as Maya kind of said at the beginning, I really think of enforcement implementation as kind of the same thing. We can pass these great policies, but if they're not enforced and implemented, and particularly equitably with a focus on kind of the most marginalized people, then we're not going to be able to disrupt the disparities that are that are just structurally part of many aspects of the system. And I think Maya had mentioned, for a lot of enforcers that we work with, really they are based on, they really work on a complaint-based model. And, that just means that they receive a complaint, and, that means that, there's obviously language access issues, and who feels comfortable calling the government, who has access to the information to reach out to government. And that creates a lot of inequities. And then within these offices, I think we all bring biases to this work. And, I think I can speak for myself and also all enforcers and attorneys in government. And so those biases just compound as a case or an enforcement action works its way up. So it's really important that we think about equity in enforcement and implementation of the laws, because if you don't, that is only going to further the disparate outcomes that we're talking about. So I wanted to kind of, talk a little bit why public enforcement, and by public enforcement, I just mean government enforcement of workers' rights, is so crucial. And I think the main reason here, and this might be familiar to many of you, is really this forced arbitration. Basically, a huge number, 24 million private sector workers in the United States who are earning less than $13 an hour, at least according to data from 2019, are subject to forced arbitration. What is forced arbitration? These are clauses in kind of employment contracts that basically prohibits workers from suing their employer in a public court of law over a dispute, no matter how egregious the violation may be. Most forced arbitration clauses also include class action bans, which prohibit individual workers from banding together and bringing a case that may be otherwise, it could just be that a person is, not being adequately compensated for overtime for, which for an individual worker might mean a lot. But, for an attorney who's representing them, that might not be a case that's like worth taking. And so, preventing class actions really is preventing a lot of workers from seeking the redress that they need for violations of the law. And we can go to the next slide, but the reality is that forced arbitration basically prevents workers from going to the courtroom. But governments, local, state, and federal governments are not bound by forced arbitration, because the whole idea is that the contract is between the worker and the employer, and a government enforcer is not a part of that contract. And so that is really why government enforcement in this space is really, really crucial. And then this slide over here is just. I just wanted to, respond a little bit to Maya's question about the enforcement landscape. I think in a nutshell, it's complicated. It depends on what area of law we're really talking about. So I chose kind of two examples to share a little bit about.
Looks like we might be having a little bit of a technical difficulty with LiJia here. For everyone who joined late, I just want to note that there's a lot of great information on these slides, and remind you that the presentation and the deck will be uploaded later. I will give LiJia a chance to hop back on, and we'll let her circle back if there are additional points she'd like to cover. So Jared, maybe we can move into some of the practical concerns here. What have workers elevated over the last year, especially, and how can law and policy work to address those concerns? How can decision makers include impacted individuals as they work towards developing those solutions?
Sure, thank you. And yeah, I'm in such suspense about what those two examples were from LiJia. So look forward to her rejoining so we can loop back. But yeah, I don't think I have to tell anybody on this webinar that workers have really been struggling this year during the pandemic. And on the issues that A Better Balance works on, we've seen tremendous need among working individuals to protect their own health and well-being, to stay employed, to meet caregiving needs. And in the past year, we've had months where we've had more than a 400% increase in caller volume on our legal helpline over the same month in 2019. So, workers have been struggling. And to touch on some of these questions and concerns that we're discussing today, I thought I would use paid sick time as an area to focus on with some of the key questions and the questions that A Better Balance thinks about at the different stages, including policy design and then enforcement after a law is passed. So as you can see here, some of the key questions, and this goes right to what Ruqaiijah was mentioning, as we're working on policies, it's essential to ask who is covered. How do we account for misclassification, increasing gig workers and the future of work generally, and the importance, for the reasons you've already heard, to make sure that policies are universal, accessible, inclusive, and that in particular, they include coverage of those who are most impacted by these policies as we think about temporary workers, seasonal, part-time employees, those in small businesses, domestic workers. You can go on, but really just key as we're thinking at the policy design point. And then thinking, what are the resources of the relevant enforcement agency, if there is one in the jurisdiction that advocates or our partners are working in? And then what are the existing enforcement mechanisms to build on in that, whether it be at state, local, or federal level? And what are gaps in existing mechanisms that we could address in a new policy like paid sick time? And then in general, what does it look like for administrative enforcement for working individuals? And this is something we hear from workers all the time, that there are barriers, once you have a valid claim, whether it be through what the enforcement process looks like, what's the timeline and the statute of limitations to file a claim after there's been a violation? Is there sufficient language access? How are individuals getting notices of where their case stands? And then what are the remedies? Are attorneys' fees available, which can be really important to whether you can find representation if you need it. And then, some of these other just key considerations. Is there proactive agency enforcement? Is an agency that has enforcement power only responding to complaints from individuals, or can they proactively go out and investigate and bring claims, which is so important, but not something that you see in a lot of labor laws, as well as the importance of a private right of action, which means the ability for a working individual to go to court, or an individual that has a claim. And that could be especially important as we think about resource questions with agencies, or whether they're overwhelmed and able to enforce in a timely and effective manner. The ability to go to court can also be extremely important. And then, as I mentioned earlier, what do the remedies look like? Are they robust? And then we'll talk a little bit more, but just to touch on now, this idea of what's known as key TAM or whistleblower enforcement is a really exciting development, particularly as LiJia mentioned some of the forced arbitration concerns that don't touch on the ability of let's say the state to enforce a claim itself. But this is a model where the state can deputize whistleblowers or representative organizations to bring claims on their behalf. So definitely something I think we'll talk a bit more. And then public education should definitely be mandated in a bill, and ideally with a role for community organizations and nonprofits to get the word out. And then just to touch briefly on kind of the post-passage equitable enforcement questions, always key to think about what does it look like to work with the agency on implementation, enforcement, if they have proactive authority, that they are using that and exercising it. Urging that there be education materials that are accessible. And then if there are legal challenges to the legislation, making sure there's support to, help ensure that it stays on the books. And then very important questions around agency budget and resources that can be key as we look around the country and think about what equitable enforcement looks like. And then what is being shared out? What are the reporting requirements in the legislation? We do like to spell it out to ensure that agencies are sharing information on what claims they're getting. Who are they receiving them from, as we think about, who is exercising their rights? How timely is the agency in following up? And then, as I mentioned, apart from just legislation, but the need for continued funding for public education and enforcement among nonprofits and community organizations. And I'm happy to talk more about different models for that. But yeah, I would say those all kind of capture the types of barriers, questions that come up and really affect the ability of workers to enforce their rights and to ensure that it is equitable.
Thanks so much. I think that point is so well taken. Funding and resources are always an issue. And I think diving into some of these long-term outcomes helps show us that putting in that investment in the front end really pays off in the back end. For the whole panel, now I'd like to kind of dive into what are some lessons that we've learned in this context from the pandemic. We've seen it's been really challenging for government to keep up with all of the concerns and worker protections. What are some ways that government can be better prepared to respond nimbly and protect workers in times of crisis? And I'll just throw this out to the group.
I'm happy to take a first stab, and I'm so sorry that my internet happened to literally the worst time for the internet to go out, but I guess it's got to happen at least once during this pandemic. But and I think maybe it's just to follow up what I was saying about I didn't get to the worker safety piece, but I think one thing that we've learned about equitable enforcement during the pandemic is that you really can't put all of your enforcement eggs in one basket. I think the worker safety enforcement is primarily handled at the federal level through OSHA, which is a sub-agency of the Department of Labor. And even though 21 states have kind of what are called state plans, which allow states to promulgate their own regulations and do their own enforcement, 29 states only have federal enforcement. And, you know, as
Oh, looks like she's back.
no. Off my camera. See if that'll help. But OSHA preempts. Can you guys hear me or no?
We can hear you.
Okay, great. OSHA preempts all other workers regularly. I basically stopped regulating worker safety laws. And that meant that, especially in the 29 states where there are non-state plan states, there just wasn't worker safety enforcement. And so I think one thing that I feel like we've learned during the pandemic is that there's kind of a need for redundancy in enforcement, that there needs to be kind of also enforcement mechanisms happening at the state and local level, and different agencies too. I think public health agencies, labor agencies, because there are different touch points that workers are kind of coming to. I think some folks might have an interaction with the public health department, and some folks might have an interaction with a Department of Labor. And you know, we can talk more about other models, but you know, for example, the state of New Jersey, through kind of an executive order 192, they basically have a joint enforcement mechanism with their State Department of Labor and the Public Health Department, which I think is a really new and exciting and innovative way of kind of handling some of these silos, and understanding that workers interact with government at different touch points, and you kind of need to meet people where they are, which I know is something that both Jared and Ruqaiijah have been talking about too.
Yes, I love that idea. Actually, I am working on a paper that talks about the need to integrate employment in our pandemic response, particularly for everything you just mentioned, LiJia, right? The fact that we often have gaps in OSHA or inspections, and so it needs to be a part of our emergency preparedness plan. So when we say we're going to do a lockdown or shutdown order, that we actually include within those orders a discussion of what should happen at essential businesses and how to protect workers. That was clear that there were gaps, right? As the CDC issued requirements for those of the general public who had either been infected or come into contact with somebody. But when they worked with the Department of Labor, it was a very different discussion, right? It was a discussion about, well, you might want to let your employees stay at home, which we know is not effective in stopping the spread of COVID-19. So I just want to raise up that suggestion again, and being very intentional about it, not only just in terms of our pandemic response, but in terms of our emergency response. We saw this in Texas, where lots of people were told to stay at home when they didn't have electricity, but then they didn't get paid. And so there are issues there. And so we really need to really need to integrate these systems of public health and employment, and enforcement and support for workers.
And I couldn't agree more with both of those comments. And what I would add is I think beyond also thinking about that approach at the systems level, to a little bit what I touched on earlier, thinking about individual policies as well, having multiple means and approaches to enforcement within a law itself is particularly important. We saw periods with not only the pandemic and its effect on workers, but also the real hit to state and local government budgets. And so what does that mean for enforcement? And that just underscores the importance of having multiple means, using paid sick time as an example. Our model legislation and what we work on around the country involves administrative enforcement, where you could go to an agency and bring a claim. As I mentioned earlier, the ability to go to court through a private right of action that can be particularly important in these moments where there could be issues with agencies' ability to enforce, be it through a budget crisis or being overwhelmed with cases. And then thinking about some other unique models that involve community groups, nonprofits, and worker centers as well, I think is just another important aspect. In addition to making sure that these laws are universal, that they cover individuals. To just build on Ruqaiijah's slides from earlier, the fact that there are more than 30 million workers in the United States that lack even a single paid sick day during this pandemic or in general, and that many who do have paid sick time can't use it to care for a child or another loved one, or don't have sufficient time, could face retaliation for taking time off or points. We also just have to step back, and I think this pandemic has just put a spotlight on, in general, the gaps in our labor laws in this country that leave many of the workers who are most affected, workers of color, workers in low-wage positions, those on the front lines and in essential jobs, very vulnerable in general, and even more so during a global pandemic. So important lessons as we move forward and try to address that.
Thank you all so much. We're getting a couple questions I see in the Q&A box. I just want to remind everyone who's attending today that if there are questions you have for the panelists, please feel free to throw those in the chat box, in the Q&A box, which is separate from the chat box there. What opportunities now, I think we've covered kind of some of the issues and some of the policy innovations that are coming up to improve conditions for workers and ensure that we have full inclusion of everyone in the economy. What opportunities do you see specifically to improve equitable enforcement of those laws once they are enacted and implemented?
So I'm happy to kick off with one example. So I mentioned the idea of key TAM, or whistleblower enforcement, also known as private attorney generals, has lots of different names. And do want to lift that up just briefly, and certainly, I know our contact information will be shared if there's follow-up questions, and there's a lot of great resources out there. But it's an exciting development, and briefly, it's a model that improves equitable enforcement and can be especially helpful when state agencies are overwhelmed or don't have enough resources to enforce every violation. And it's the idea that key TAM enforcement provisions authorize whistleblowers to bring cases on behalf of the state, if we're talking at the state level, for example, and on behalf of affected workers. So some of you, if you're in California, may be familiar with the California Private Attorney General's Act that has helped the state to, have greater compliance with its labor laws. But it's a model that, is increasingly being advanced around the country. We've included it in our model legislation for paid sick time as an example, and partners like NELP and Center for Popular Democracy and others are also working on this in other labor contexts. But just briefly, it's a model where, for example, a worker or a whistleblower who fears retaliation can authorize a nonprofit to represent them. The state can intervene or enforce the claim themselves, or allow the whistleblower or their representative organization to enforce the claims on behalf of the state. And typically how these provisions work is that if it's successful, the relief and penalties will be split among the state, which is important because it creates new revenue for the state to do enforcement, particularly if there are budget constraints. Relief for affected workers with a service fee to the nonprofit or representative organization, and a portion for grants to community groups for outreach and education. So it's an exciting model, one that I think does move us towards much more equitable enforcement, and we're seeing some momentum around. So here in Colorado, where I'm based, law passed last year that's known as FEW, the Public Health Emergency Whistleblower Law. And it includes a key TAM enforcement provision that's already being used to bring claims on health and safety issues around COVID-19 on behalf of classes of affected workers. So just one example of, I think, some really innovative new models.
Ruqaiijah, I wonder if you could speak to the same question and the same issues around agricultural workers. That's come up a lot in our questions that we received in the registrations. And I know there's been a lot of focus on urban centers and downtowns, but we also have these huge concerns in rural and agricultural areas.
So what we have seen in terms of enforcement has sometimes been prompted by strikes. And so definitely during COVID-19, many workers have decided to strike either because they found out they've been infected, unfortunately on the media, and that was the case in one farm in California. We've seen lawsuits against the states in terms of trying to ensure that there is enough spacing within some of the housing facilities, right? Because they're often owned by those who own the farms. One of the most, I think, effective was the lawsuit to actually get overtime wages for farm workers that happen in Washington. But I would say that the key is not only sort of legal enforcement by workers and support from those groups, but also being able to put pressure on the continuing business and the work that employers are doing. We shouldn't have to go that way. And my hope is that as we move forward from this, excuse me, as we move forward from this, is that we will take these lessons and then implement these policy strategies into the law. Right. And then give people workers' power, which they did with the Los Angeles County Board of Supervisors, where they gave workers the ability to form employee councils that could actually report some of the health and safety violations. So I think that is really key, centering the workers and then providing support for them to be able to do the work that they need. And I think, which I saw in some of the comments, right? It's also about supporting the ways that they want to unionize, and whether that's in the traditional sense or whether that's just empowering groups to actually work together across agriculture, meat and poultry processing, healthcare, that we really need to support them getting the power that they need to make these substantive changes and then involving them as we make the changes.
And then LiJia, I wonder if you could talk a little bit about the role of government here. I know Public Rights Project does a lot of work on that enforcement gap of government not always proactively enforcing those laws that already exist. So are there some creative opportunities here? Are there jurisdictions that you've seen that have reacted particularly well to the COVID-19 issues that have been raised?
Yeah, I think I'll maybe just expound a little bit more on actually an example that Ruqaiijah spoke about with Los Angeles County and the public health councils, that model that has been set up there. And I think, just a little bit more context is kind of one of the ways of responding, or kind of, I think, to get around the complaint-based model and some of what we think are kind of built-in biases and disparities in that model is proactive outreach with communities that you're not hearing from as much, but are kind of marginalized in your jurisdiction. I think, especially for all the government folks, I think you guys have a sense of where, there are immigrant communities, there are low income communities, and you're probably likely oftentimes not hearing as much from them, but there are, community-based organizations that are working in those communities and building those relationships. Frankly, I think the cities and counties and states that have done the best are places where they have those relationships pre-existing, and you're just not trying to build the relationship for the first time in the pandemic. So hopefully this is a, inspiration for all of you to kind of build those relationships before a crisis comes on. But I think one thing that LA County did that Ruqaiijah already mentioned, but I'll just share a little bit more about is, the Board of Supervisors passed an ordinance that provided funding for employee councils, worker councils for specific industries where they were seeing a lot of spread of COVID. And, third-party community-based organizations, worker organizations that know how to talk to workers and engage them and meet them where they are and, empower them, would educate them about their rights. The county also recently passed an anti-retaliation ordinance. So educating them about, you can speak up about worker safety in your workplace, and you can't be fired for that, is, something that workers don't necessarily know. They're not necessarily aware of what protections they have. And then I think one of the very cool things about this model is that these councils then have kind of a direct relationship with the public health department. So complaints that they raise about, something that they're seeing in a workplace that is troubling can go directly to the health department. And I know we have a bunch of health department folks here, but I think my understanding is health departments don't necessarily engage directly with workers in this way. And so kind of having that direct relationship where it doesn't have to go through another agency is, I think, one way to kind of, I think, get around a lot of the problems that we see with the current inequitable enforcement of many of our employment laws.
Thanks, LiJia. And as she mentioned, I know there are a lot of health department folks. So if that's something that's in your experience you'd like to speak to, just feel free to speak up in the chat box, or again, if there's a question you'd like to raise in the Q&A, that's a great way to reach our panelists here. And then I'd like to move on to kind of thinking about a bigger picture. And one of the questions that we did get in the chat box is, I'm curious about how we use our experience with COVID as a pivot point into a new normal, but in a very intentional manner. So we are hopefully seeing a bit of light at the end of the tunnel as we have vaccinations ramping up and we see different places slowly reopening. What do you think is the future of work and enforcement of labor protections, and how can we bring in some of these modifications and innovations that we've seen with COVID and pivot very intentionally into that new normal?
So I'll jump in since nobody else has yet. I think one of the things that I would love to see is that we take the model from the LA County and use it across the country, and in particular on the federal level. I think a couple former officials from OSHA and the Department of Labor, David Michaels, highlighted the need to actually begin to instill community boards and employees within the Department of Labor on the federal level and throughout states. And so what I would hope is that we would adopt some of the things that we are already seeing being done really well on the state level. I think some other things that we need to fix but hopefully we will begin to look at that as workers' comp. And I don't think we've talked about that yet. It's just the ways that workers' comp is not accessible to all essential workers, particularly during COVID-19. You'll see in states, I think even in Minnesota, where all of the claims by meat and poultry processing workers have been denied. And so states like Virginia, I think California and Michigan have tried to make it easier for workers to actually be able to get workers' comp, right? There's a presumption, but that is not the case across the board. And so really ensuring that we start from the beginning of wage theft, paid sick leave, and go all the way through to workers' comp to say that these are all connected.
Yes, I agree with that completely. And I think, over the past year, the pandemic, and I mentioned this earlier, I think has put a spotlight on a lot of glaring gaps in the law and labor policy that existed before the pandemic, but it has led to some new opportunities to address them. Certainly we've seen increased demand for bill support on the issues that we work on around the country. I think it's also put a spotlight that as we move towards a new normal, to also address preemption, which we've talked about a bit, where there are many states that have not only not created labor standards themselves or worker health and safety standards, but also prevent localities from doing so. And that's something that I think the pandemic again has put a spotlight on how states increasingly are interfering and really abusing preemption to prevent local protections from being passed in many states around the country. And then I do think, just to build on the earlier comments, it really does point towards this need to engage the community more, to engage community organizations. And one additional example beyond the California ones that were raised earlier, I think is Seattle has provided a good model, and you can find some information if you look at their Office of Labor Standards website. But in December 2019, Seattle chose 9 community-based organizations to receive, among them, more than $3 million in funding over a 2-year period that we're in now, to provide outreach, education, and worker support to low-wage workers. And it's a great list of organizations that are working in many different communities, and individuals that are unsheltered, those working in small businesses and from different populations. So, I think a lot of new models are needed as we go forward for how we engage the community. And as a lawyer who works on a lot of bills, the importance of also not only authorizing, which is important, agencies that have enforcement to be able to do so, to do grants, for example, to community organizations, but also thinking about requiring it as part of the policies that we're passing, because that's so important. We can pass the laws, but we need to make sure that those who are covered by them are able to find out about their rights and then enforce them.
And maybe I'll just add, I think, all of the need for policy innovations to, I think, really address these issues and gaps we're seeing are just so true. And I cannot agree with Jared and Ruqaiijah more. But I think maybe just to kind of think about it in terms of framing, one thing I think about is just building our resiliency for future crises and realizing that resiliency is like in our communities and how we treat and protect, especially minimum standards for workers. And that community resiliency is we need to think about it in a broader way than what we thought about it before. And then that's one thing that I think about in terms of like moving into a new normal. And then another thing that I think is really helpful that this period of time has taught me, and I think has taught all of us, is that a lot of things that I think on the policy level, we've been told, especially for us advocates, were never possible, like an eviction moratorium, a nationwide eviction moratorium that's coming from the CDC. Could we have ever imagined that would be happening? No, but I think, I think it just, for all of us who are working in these roles of, relative power to be able to influence in whatever small way we can is, thinking that what is possible might actually be beyond what we imagined before the pandemic. And so I think for me, that's just something that I've learned and I want to take into the future work that we do with great intention, because, we might be limiting ourselves for what resilient systems and the flourishing that we're allowing for workers in our communities if we limit ourselves and say we can only ask for this much. And, I say that understanding that we all live in different political realities. And, in some places it might just be challenging with the political reality. But I wanted to also put that out there as like something that in my mind has shifted a little bit doing this work.
Thanks for lifting that up. I think that's such a great point. Returning to the Q&A box here, we have another question about agricultural workers, and I think tomorrow is Cesar Chavez Day, so it's really timely to recognize the impact of agricultural workers and migrant workers. And this is a question from Irene. Healthcare workers and teachers are examples of groups of people who have been recognized as rock stars and heroes and the frontline folks who are bringing us through this pandemic. Has anyone started a campaign to recognize the heroes and rock stars who are agricultural workers? In Washington State, we depend on agricultural workers for our economy and day-to-day living, but we haven't seen nationally nor within Washington State outside of Olympia many of these migrant workers due to racism. What are your thoughts? And I'd just like to raise that the city of Coachella in California, I believe, was the first in the country to adopt an ordinance mandating hazard pay for agricultural workers. We've seen some of that in the grocery and restaurant and food service industry. I think that's being challenged by the growers now. And then, of course, the protections for so many of these migrant workers who may also be undocumented has been really difficult. I know in California, we've seen some funds administered by nonprofits for undocumented workers who may not be eligible for state or federal assistance. Is there more you can add to that conversation about recognizing the contributions of these migrant workers, these agricultural workers, and how can we better enforce the protections that we know are lacking?
I can jump in really quickly. I would just say I hesitate highlighting one particular group as heroes, because even when we do that, there's still race and class and gender that leaves people out. So even though we highlight healthcare workers, that's only a small group of healthcare workers that often ignores the people who are cleaning in the hospital, the people who are providing trays. And so a lot of the people who are still doing the jobs that we need are left out. And those traditionally are low income, people of color, women. And when you even think about the disproportionate impact that we see among nurses who have died, right? And so there's a higher rate of Filipino nurses who have died, that we're not lifting them up and calling them heroes. And so even if we move forward with highlighting that these people are heroes, we need to ensure that our biases don't come in, right? And so only particular people are heroes, right? Those who are citizens are heroes. And I would finally just say is that calling somebody a hero is never enough. Right. We've called healthcare workers heroes and teachers heroes, and then we haven't provided them with the PPEs, the paid sick leave, the hazard pay, all the things that they really need. So to me, it's more about don't call them a hero, provide them with the protections and the pay that they need, and then just let them continue doing their work, but really give them the things that they need.
Jared or LiJia, did you have any comments on that question? I think that is such a great point, and we've seen that come up again and again in so many different contexts. I think it like Ruqaiijah mentioned, it was the healthcare context and teachers, childcare, parents. It's like everyone is out there recognizing the struggle, but then not providing the supports or the services that are necessary.
Yeah, I don't think I could say it better. Ruqaiijah, that was totally on point. And I do think, as we draft and negotiate bills, I mean, it is a challenge to ensure that they protect those who need it the most. And I do think this is a year that has shown those gaps for essential workers in a number of different ways, both what's been passed federally, which Ruqaiijah, you had mentioned, and federal emergency paid sick leave, as well as other protections. So the need to use that as an opportunity to ensure that the laws that we're passing honor and protect those who are protecting us, because this past year has shown that our laws don't do that. So I think it's, as we pivot towards, as someone mentioned in the chat, a new normal, I do think the new normal has to involve policy that is universal, that covers individuals in all sectors and gets the protection and rights that they need.
And I think one thing that we are trying to highlight in our equitable enforcement work is that so often we come at enforcement from this punitive viewpoint, punitive perspective, that we're trying to punish someone for not complying with the law. And instead, are there things that we can do to encourage compliance or shift these burdens? And one of the questions that came up through the registration is whether there are some actionable strategies or ideas out there to encourage employers to prioritize the health of their workers. We know, obviously, this is a bottom line question for employers. When their workforce is healthy, they're more productive. But if it's another, worker safety and worker rights issue as well. So are there some actionable strategies you've seen? Are there interesting proactive governmental interventions? I'd love to hear from all of you about that.
Well, I think one thing that, frankly, I think a lot of cities and counties and states do this, but I think the same public education that that governments can do with workers, they can and should also do that with employers, right? I think there are a lot of employers that want to follow the law and want to comply and want to provide best practices, but there also needs to be kind of public education that's coming from the government side for those employers as well. And then I think there have been in some instances for small businesses, I think some cities also have, depending on the type of policy, some like an ease in time to allow policies to kind of come in slowly so that, employers can adjust their practices, and also in some instances, like some, grants or, support from government to kind of support compliance with those laws. And of course, I think that's not quite what you're saying about kind of incentivizing even better practices above and beyond. But I think kind of the outreach and the engagement to employers is also just a crucial part of this, because, they are part of the system and part of what makes all of this work. So I think outreach to them and communicating with them is a crucial component of this.
And then another thing that comes up a lot and has been raised in our questions too is the kind of the conflict of enforcement through policing to enforce these health department orders. So we want those orders enforced to protect health, but then we know that police interactions can create their own health inequities as well. Have you seen good examples of either, ways to take police out of that equation, to give more power to health departments to do enforcement, or, are there other creative strategies we can use to mitigate that?
Yeah, I think, for me, that points to, and certainly it would depend on the type of policy and what, we're thinking about when it comes to health, safety, workplace rights. But, to me, it underscores that earlier point of multiple methods of enforcement, because as we at A Better Balance talk to individuals who are trying to enforce their rights or have faced violations, it's very individual what method of enforcement might work best, whether it is going to an agency directly, whether going to court might make sense, thinking about what practices an enforcement agency might have for taking anonymous complaints and then doing proactive investigations, thinking about that whistleblower model. So I do think, my initial thought is that just also underscores the importance of having multiple means to enforce these protections, since you're right, it could have certain aspects of it could have risks for certain individuals, and that calculus looks very different for different individuals.
Thanks. And I think that connects so neatly to kind of LiJia's thoughts about creating these processes and structures before we come into the emergency, because what we've seen in so many jurisdictions is that it's been really difficult to balance the speed with the sort of inclusive and equitable process that's ideal. So in order to be able to respond quickly to a really pressing public health crisis, doesn't leave a lot of time to suddenly connect with all these stakeholders and bring everyone to the table. So I think we have seen some good efforts. I know in King County and Boston have been lifted up, or Chicago have been lifted up as examples of where they've brought in a lot of different stakeholders to evaluate and iterate on these emergency interventions. And then the hope is that you preserve those relationships and keep that going. So the next time, because I think some of our speakers have, or our attendees have pointed out in the chat, it is when and not if, when we run into another public health crisis, to already have those structures and processes in place.
And I'll just hop in really quickly. I think for me, I focused on integrating employment into our pandemic health response. I think it's really integrating the social determinants of health, the structural determinants of health, political determinants of health into our response, right? And so they're not different. You just pivot a little bit, right? And so you've already begun to do the work to address these inequities and to get people to health equity. And so you just build upon that in your pandemic response, right? And so if you've already built the relationships, you already know that there may be some food insecurity within that community. And so perhaps now, instead of just providing meals on Sunday, you know that you're going to use the school to provide it throughout the week. Right. And we've seen lots of communities begin to do that. But if you're already doing that and partnering with communities, then why not just pivot to more of that during the pandemic? And that's the same thing for workers. Right. And so really building in this concept that social determinants of health continue and just ramp up as we go through a pandemic response. And so should our funding. Right. So our funding should be that we're funding this at a level we can address it and eradicate some of these problems. And then we ramp up immediately when we know that there's an emergency situation.
Yes, that is so critical and so apt. I'm going to throw up some resources on the slides now as we near the close of our discussion. I really appreciate everyone joining us today. So we've all got some different resources that are available on our respective websites. Again, this will be available to you about a week after this webinar. These will be on the ChangeLab website. On our next page, we have some readings that Ruqaiijah has provided. And those will all be linked on the slide deck that will be posted on the website as well. And then we've got some resources on Jared's website. There are some tools, some charts of laws in effect, some resources, fact sheets, and model bills specific to COVID-19, as well as a free legal helpline. And then our last page, you'll find our contact information. So definitely feel free to reach out by email or on Twitter if you have questions for any of our panelists. The next session in this series in April will focus on inequities in the education sector. Registration for that session will open in the next week or so. Please visit our website, changelabsolutions.org, or follow us on Twitter for more information. And our Twitter handle is @ChangeLabWorks. Thank you so much to our panelists for a really great discussion, and thanks to all our attendees for joining us today.